Hi there, my name is Ron Pereira, and I'd like to welcome you to Stories About the 8 Types of Waste in Healthcare. Now, this course was facilitated by Mark Graben in webinar format. During this presentation, Mark introduces the different types of waste he's encountered within the healthcare world, as well as how to counter these situations. Mark delivers his message by sharing powerful, real-world stories. Now, we've split the presentation up into short modules, making it easy to find a specific topic. However, if you decide that you'd like to view the full, unedited presentation, simply scroll to the end of the course where you'll find the full video. Now, allow me to introduce your facilitator. Mark Graben is an internationally recognized consultant, author, speaker, and blogger. He's learned, practiced, and taught lean and continuous improvement methodologies in settings including manufacturing, healthcare, and startups. Mark is the author of the book Lean Hospitals and is co-author of a second book titled Healthcare Kaizen. Both books are recipients of the Shingo Professional Publication and Research Award. Mark also published a book in 2018 that focuses on process behavior charts called Measures of Success: React Less, Lead Better, Improve More. Mark earned a BS in Industrial Engineering from Northwestern University and also graduated from MIT, where he earned an MS in Mechanical Engineering and an MBA from the MIT Sloan's Leaders for Global Operations program. Finally, Mark's created a dedicated landing page with notes and information related to this presentation. We'll link to this page in the resources section, or you can go directly to the website by typing this URL into your browser.
I want to talk today about the types of waste in healthcare. Now, sometimes people say lean, it's all about reducing waste. And yeah, I think reducing waste is a good start. Reducing the 8 types of waste is a good start. We're also going to talk about value and what that means to patients and the healthcare setting. And when I first decided to do the webinar, originally I was going to try to do 8 stories about 8 different types of waste. But as I started kind of pulling together different stories, and I realized it's hard to find a story that's just about one type of waste, because it's all very interconnected. One type of waste leads to another. They're both present at the same time. And some types of waste are certainly worse than others. So I'm going to tell some stories from my own work, some stories that you may have heard of out there in the healthcare land, telling those stories in the context of lean. And so, when we talk about waste, when we identify problems in the lean methodology, it's honestly not always very uplifting. The problems are the reality of the current state. It's not always pretty, but it is what it is. Now, people listening and attending might be either just interested in lean healthcare. Maybe you want to come in from the outside, and I would say, please come on in. There's a lot of waste to reduce in healthcare. You might be new to lean as a healthcare professional. You might have been at a hospital that's been using lean for a while. I'm hoping either way that this webinar is a good introduction or a reminder. I think we need to fix the things that really matter most in healthcare. I think as a lean community, we need to help our leaders understand that lean needs to be first about safety for patients and for healthcare workers, and quality and access and waiting times. And with that, cost is a happy end result. And I think we all need to maybe try a little harder, myself included, to push back if we're just being asked to cut costs. If we focus on first things first, we'll find that we're really going to reach the potential of what lean can do in healthcare across a lot of different dimensions. So we see this number here, $765 billion. Well, that number, of course, represents the amount of wasted healthcare spending in the United States in 2009, according to a recent Institute of Medicine report. And I'll have a link to that report in the notes that are going to be distributed after the presentation. We're burning money, $765 billion a year. And most every country around the world, even though nobody spends as much as the U.S., everybody is struggling with the idea that we're spending too much or we don't have enough of a budget and we need to reduce the waste in healthcare spending. Now, to put this big number in context, let's look at an even bigger number. Of our total U.S. healthcare spending, again, 2009, $2.5 trillion. That's 18% of GDP. We're now spending close to $3 trillion. And the next highest major country to the U.S. is spending about 12% of GDP. So again, this is a problem around the world. We might not be spending as much as the U.S., but everyone feels under pressure to reduce and contain costs. Now, the Institute of Medicine says it's easier to identify waste than it is to reduce it, and I think they're absolutely correct. One thing they recommend at a very high level, if you look at their report, is that we need healthcare organizations that are continuously learning and continuously improving. And this report actually cites and recommends lean, and it sounds exactly like lean and the idea of Kaizen, or improvement and continuous improvement. We need system redesign, and we need continuous improvement. Now, if you look at the breakdown in the IOM report of that $765 billion, what are the contributors to either setting that money on fire or flushing it down the toilet, regardless of how you might want to look at this? With my weird pie chart here, we look at some of the big contributors. We see things like fraud, mispreventive opportunities, excessive administrative costs. I think the two buckets of waste that are maybe most clearly addressable with lean include the category of what the IOM calls inefficiently delivered services of $130 billion a year. This means quality problems. This means inefficiencies in the delivery of care that patients should be receiving. Then there's this even bigger category or bucket that they call unnecessary services, $210 billion of waste. In lean, we would probably call this overprocessing or overproduction. Providing care that doesn't provide any value, that doesn't help the patient. We'll talk about a few examples of those today. So clearly, there are opportunities in healthcare to save money by reducing these different types of waste, which is a different approach than, I think, kind of the traditional approach of cost cutting that we see in healthcare, which often leads to, because labor is 60 or 70% of cost for a health system, cost cutting often just directly means layoffs. Now, the good news with lean is that it gives us a fighting chance to improve and redesign processes, to look at things in a new way, to improve the way care is delivered and take waste out of the system instead of just slashing headcount. And I think we need to focus on not just the financial cost of poor quality, inefficiently delivered services, and think of some of the human cost as well. So the picture you see here is a little patient, Malia Jeffers. And her story, unfortunately, I think really illustrates the pain and harm that comes from the waste of waiting. Now, Malia was 2 years old. Her parents brought her to the emergency department in the Sacramento hospital. She had a fever. She was kind of turning purple. She was weak. And while in the waiting room, as she was waiting and waiting, Malia grew sicker and weaker. Now, her parents repeatedly asked and even begged hospital workers to treat their daughter. And the hospital said, well, no, she's not the highest priority right now. And they were continuing to wait. Well, it was 5 hours before Malia was first seen by a doctor, according to court documents, because there were lawsuits and eventually a $10 million settlement. And I emphasize the $10 million number not to say, well, that's $10 million of cost we should reduce. That's the settlement from the harm that occurred to Malia because she wasn't seen promptly, because patient flow was not what it could be in the emergency department. And we see, thankfully, lots of emergency departments around the world using lean concepts to redesign and improve patient flow so that nobody has to wait 5 hours. So unfortunately, in the case of Malia, she got worse and worse. She was flown to a children's hospital, and the doctors there found she had Streptococcus A bacteria that had invaded her bloodstream and organs, and they had to amputate parts of both hands and both of her feet. But she's now walking on prosthetics as a 4-year-old girl, which shows the very best of what healthcare can accomplish. Now, in the sad aftermath of this tragedy, the hospital says they've added new policies and procedures and audits. They've assigned a nurse to the ER lobby 24/7 to assess patients as they're waiting. Like, well, wait a minute, are they really addressing the root cause and fixing the system to reduce this type of waiting? A news story said the hospital didn't want to comment on any possible disciplinary procedures that might have taken place, which, unfortunately, I hope it's not the case. Sounds like the old habit of blaming individuals for what are systemic problems. And we look at the waste of waiting time. This is not just a matter of efficiency. In fact, if we look at trade-offs, one reason there's a lot of waiting is because the focus is placed on high utilization of people, of rooms, of beds. And if you look at the book on ED improvement by Jody Crane and Chuck Noon, they talk about the need to not focus on 100% utilization, whether it's for ORs or MRI machines or for ERs. When we have 100% utilization, basic industrial engineering and queuing theory tells us we are going to have long waiting times. So maybe we need to rethink the idea of, it's really obvious when we see a healthcare professional who's waiting, who's not doing anything. But sometimes for good flow and for an efficient system, we need resources that are quote-unquote wasted so that we don't have the waste of long waiting times and patient harm that sadly occurs as a result. So the 6 words you see here, this was something I saw posted. I visited a hospital in the UK that was implementing lean, if you will. They were trying to transition to a lean culture. They emphasized their purpose for lean: no waiting, no waste, zero harm. Now, harm and waiting are types of waste, subsets of waste. Waiting can lead to harm, But the lean approach is both patient and staff focused. We don't want patients waiting. We certainly don't want to harm them. We don't want staff members running around ragged all day long, firefighting, jumping through hoops, dealing with waste. And we certainly don't blame staff for the waste. It's not their fault. They're doing the best they can in what's often a broken system. So by eliminating that waste, better taking care and providing better systems for the staff, that allows them to take better care of our patients.